is an ovarian cyst? Ovarian cyst is a very common condition, often painless or symptomless, and usually it's a sign of a normal menstrual cycle or ovulation. Therefore, there is what we call a follicular cyst, which is a functional cyst, which is a normal cyst, which is developed every month in every woman who is during reproductive age. This follicular cyst developed, and inside that follicular cyst, you have an egg. And usually in the mid-cycle or around 14 day of your 28-day cycle, that follicular cyst rupture, and that process we call it ovulation. And during that ovulation, an egg is expelled, and the woman go to the second phase of the menstruation, which is called a luteal phase. And it is during this phase where now an egg and a sperm will meet, and then also implantation will happen during this stage of the woman menstrual cycle. If a fertilized egg is not implanted, then that woman will go back and have menstruation and restart again with the normal menstrual cycle. Basically, a follicular phase is when the ovaries are making the follicles or the eggs which are ready for ovulation and fertilization. Now, after the eggs or ovulation have happened, what is remaining is called corpus luteal cyst in the ovary. It's usually, when you see it with the laparoscopy, it's actually a bit yellowish, and it's a normal cyst which disappeared with time. Now, you may have a third form of a cyst in a woman, because I've talked about two, which is a follicular cyst, which is normal, corpus luteal cyst, which is normal, and you've got what is called cystadenoma, a common benign epithelial neoplasia, which is carrying no excellent prognosis. Therefore, it's benign, it's not cancerous. Now, cystadenoma is also the third commonest form of a cyst which you can have. And this particular form of a cyst usually is treated by cystadenectomy. The third form of a cyst which you can have is called a dermoid cyst. This cyst typically contains fully matured tissue that can be skin tissue. It's like skin. It can be having hair inside. It can have even teeth, but it's got a lot of glandular cells inside, like sebum gland, which you get mostly in acne. And this is also a benign, although some may be actually cancerous, but majority of the time a dermoid cyst is a benign also, which can be treated easily by doing cystectomy laparoscopically. The fifth form of cyst is called endometrioma. This is a form or type of what we call a deep infiltrating endometriosis of the ovary. It grows in the ovary and disturbs ovarian function, and even it can cause infertility and pain. Some people call it a chocolate cyst. Ovarians. Now, what are the symptoms of ovarian cyst? You have abdominal bloating and swelling, painful bowel movement, constipation, pelvic pain before and during menstruation, painful intercourse, pain in the lower abdomen, left or right, breast tenderness, nausea, and vomiting. This may be the symptoms of ovarian cyst. How do I know if I have ovarian cyst? Fear, sharp pelvic pain, fever, faintness, dizziness, or even rapid breathing due to the pain it can cause. Then we can diagnose ovarian cyst by firstly making a proper gynecological examination, using a transvaginal ultrasound if the cyst is within the pelvis. But if it's a huge cyst which came out of the abdomen, out of the pelvis into abdomen, therefore a transabdominal ultrasound may be actually effective. CT scan can also assist, and MRI, which are done at the radiology, can also assist to diagnose this ovarian cyst, and can also give us an indication of whether it's a benign or it's a malignant cyst. How do we treat an ovarian cyst? Most ovarian cysts, as I said, are benign and naturally very small, and they don't give any symptoms, and therefore they don't need any treatment. But some, they may require some form of a treatment, and the option may be surgery. It can be treated by laparoscopically, and that is called cystectomy. And you can also do a laparotomy, especially if it has some element of being benign. In this case, you can do what is called oophorectomy. Therefore, complications of ovarian cyst are rare, but they can happen. One of the commonest complications, it can be ovarian torsion. In this case, we may be worried that you may lose your ovary, and that may also decrease your fertility and even your hormonal production in general. It can cause internal bleeding, and also there may be element of cancer. Therefore, these are probably the three complications which you may have from ovarian cyst. Prevention of ovarian cyst has been shown by many studies that oral contraception are the most important or the common treatment or method which we can prevent ovarian cyst. Thank you.